I want to welcome everyone to week 6 of our ASAN summer webinar series. We've been giving these webinars since July 6th, every Tuesday at this time. And we have this week, week 6, we have 2 more webinars, which we'll announce shortly. And then our webinars will be complete. My name's Bill Carrick. I'm lucky enough to be the president of ASAN, and ASAN is the American Society of Addiction Nursing. We want to thank our sponsor today. Specifically, I want to thank Recovery Management Solutions. They've been kind enough to sponsor this whole webinar series, so we appreciate that. Thank you. Please keep your cameras on and please mute your microphones now. Everyone, please check it now. Sometimes somebody forgets and all of a sudden we hear somebody doing the dishes. So no clatter. Please post questions in the chat box. The chat box has already started. Suzanne welcomed everybody. So please post your questions in there and Al will provide answers at the end of the webinar. You must complete the daily session surveys. The link to each session survey is on the schedule page at addictionnursing.org/summer. Now, this conference has been approved for 8 nursing CEUs through the California Board of Nursing. This webinar today will be approved for 1 CEU. If you've attended all of them so far, this will be 6 CEUs for you. A certificate of completion with a CE will be sent by email with verification that the survey has been completed. We are currently being recorded. All sessions will be recorded and archived on the schedule page for viewing if attendees are unable to participate in the live sessions. Now we're going to keep those up for another 2 months, and then we will put them in our store. So please encourage your colleagues to view them if you feel that it would be valuable. CEs are available for recorded session viewing with a completed survey. Here's our distinguished board of directors. Thank you. ASAN is a relatively new society, and the board here has been doing a lot of work to get it off the ground. I've introduced myself. Suzanne Kinkle is the vice president. She's on the call. Bill Lorman is our treasurer. Ginny Coletti is our secretary. And Carolyn Baird is also on the call this evening, as is Fran Campbell and Mary Armstrong Fougere. They are all directors on our board. So thank you all to them. So our webinar series is every Tuesday at 7 p.m. Eastern for 1 hour through August 24th. Today, Al Rundio is presenting holistic addiction treatment services. Week 7, we are going to have Virginia Coletti and Diane Snow present common psychiatric disorders in relation to substance use disorder. And on week 8, August 24th, Dr. James Ferguson will be presenting laboratory tests for substance use disorder. Again, you can see our video archive at addictionnursing.org/summer. Al Rundio, it's Dr. Al Rundio. He has quite a few credentials. I would like to point out that he is a CARN AP, a Certified Addictions Registered Nurse, Advanced Placement. And for those RNs out there, if you're interested in becoming a Certified Addictions Registered Nurse, I would encourage you to go to the ANCB website and start looking at how you can get certified. Al is a clinical professor of nursing at Drexel University in Philadelphia. He's also a nurse practitioner for addiction treatment services in Atlantic City. He has a private practice as well. You see the learner objectives up there. Define a minimum of 2 types of holistic treatment, describe how holistic treatment benefits clients, and explore other types of holistic services. And at this point in time, I'm happy to have Al take over. Thank you, Al.
Thank you so much. So we will get started. Um, so the first thing I want to say, and I'll give you an overview of our facility, but I'm very pleased to announce that our director of nursing, and hopefully I had a little role in helping her prep for it, just passed the CARN exam this past Friday. So we now have a director of nursing who is certified as a CARN, and we're really proud of that. So the facility that I'm affiliated with, we have a total of 26 beds. Six of them are residential and then 20 detox beds. And it's in Atlantic City, New Jersey. It's right on the bay as you would enter Atlantic City if you're familiar with the area. Um, so there's a lot of boats and everything around. We also have a partial hospital program, an intensive outpatient program, and an outpatient program in Egg Harbor City, New Jersey, which actually is kind of my hometown where I was raised, which is about 10 miles from Atlantic City. And the PHP program is a really neat program where clients live in Serenity houses along the beach blocks in Atlantic City, Ventnor, Margate, those areas. And then they are transported Monday through Saturday, and they attend the partial hospital program from 8:30 in the morning to 3:30 in the afternoon. And then they're shuttled back to their respective houses. Um, and that's where we do holistic treatment both in detox, but the full array of services is on the campus in Egg Harbor City because there are several acres to that campus. It's not landlocked like we are in Atlantic City, and there's a lot of services that can be provided. The facility also has an intensive outpatient program in Ventnor, New Jersey, which is a border community. We have an IOP program in Philadelphia. We have a partial hospital program, an IOP, and an outpatient program in Dover, New Jersey, which is near Randolph, New Jersey. That's way north. And we also have a holistic cafe in Ventnor, New Jersey, where people anyone can go and eat dinner, eat breakfast, eat lunch. On the main campus in Egg Harbor City, where the PHP program is, we have a large farm with all the food is homegrown organically. So the program philosophy, simply put, and I didn't put the whole mission statement and the written philosophy, but basically the belief is that you got to cleanse the entire body, not just from substances of abuse, but from any type of artificial food or elements. So you will not find white sugar on the property or anything like that. So these are the services that I want to cover. Now, obviously, we do acute detox and we do use all the standard protocols and medications that you need for detox. And certainly the clients that are housed in the partial hospital program and our IOP program in Ventnor, we also service their medical needs as well as all their medications, because some of them will be on, some psychotropic medications. Sometimes when you first detox, you may need a couple weeks where you need some clonidine or Vistarol for anxiety. So, they do believe in medication management. But tonight, what I really want to cover are the holistic services. And I think what led me to this lecture, I had published a book on the opioid epidemic back in 2020. And I had Dr. Rita Carroll, who does our complementary and integrative therapy program at Drexel, contribute a chapter to the book. She then went through the same publisher and published a book on substance use disorders and holistic treatment. And then she asked me to write a chapter in her book, which I did, and that book was recently published. And that's what led me to this lecture. A lot of what is in this lecture really came from the chapter I wrote in that book. And you know how you have to do kind of like an outline when you write a book. My goal was to share the services that we provide, but then also to get some interviews with clients to see what services they found most beneficial from a holistic standpoint, which led them to maintain sobriety. So acupuncture is done in our partial hospital program. We have a chiropractor who comes a couple days a week. Acupuncture uses traditional Chinese medicine to rebalance what we call a person's chi, or energy flow within their body. And of course, as you know, you insert thin needles to specialized points in the body. This program is available every morning for the partial hospital program and outpatient persons as one of 3 morning practices offered each day to help them start their day with balance, grounded, and healthy intentions. Art therapy. We do have a therapist that comes in every Saturday on the detox unit. And then we have art therapy going on twice a week in the partial hospital program. It's facilitated by a full-time creative arts therapist. They engage in multiple types of creative art that varies from painting and drawing, sculpture, collage. It's been shown to be a highly effective means of nonverbal self-expression and processing. And persons often struggling with more severe co-occurring mental health issues often will find art as a very healing and non-threatening means of a deeper recovery process. And what we find on the detox unit, when the therapist does art therapy with those clients, it's just amazing how proud they get because some of the work is simply beautiful. And it shows them that, they have a lot of artistic talent. Well, I put the picture of the horse and the dog here because I happen to be a dog lover. So when I found this picture, I had to snatch that one with the horse. But we do equine agala therapy. So agala is a specific type of equine therapy. This therapy pairs a licensed mental health therapist with an equine specialist. It's an experientially based therapy where persons get familiar with horses as well as riding them. We use small groups of no more than 10 or 12 persons that participate in each therapy session. Family constellations. Now, this will differ from traditional family therapy. The goal here is to turn the person's brain off so that family issues can be resolved. The goal is also to resolve the person's trauma. And that triggers my brain to say, we have a lot of counselors, and we're very proud right now. We have really about, if I counted, about 4 master's prepared counselors. We have 2 CIDCs, and one of the CIDCs is going for her master's degree in social work. And then we actually have 2 of our staff people who are working on their CIDC, and both of them are enrolled at Rutgers University, getting their master's degree as well. So they really have a pretty talented group in the counseling area on the partial hospital program. So with family constellations, what's different is that the therapist will start playing what's called a didgeridoo. This is an Australian wind instrument that's played with continuously vibrating lips that kind of produces a continuous tone while using a special breathing technique called circular breathing. And the whole thing is to get the client to relax, but also to share in a family therapy session. We contract with a facility about 5 miles from the place, and they have these flotation tanks. And the only way I can describe them is they kind of look like a big, kind of beautiful oyster, but the top goes over it. And people immerse themselves in Epsom salt water. And they lie flat, usually in the Epsom salt water for 90 minutes. Most clients love it because they say it's very relaxing. The sessions are 90 minutes long, and they say it relieves stress and anxiety. I mentioned that we have a holistic farm. This is an organic farm that clients learn to care for. Many of our clients, and when I get to another part of the program, I'll share some of that, but actually become employees and stay in treatment, in the IOP program or the outpatient programs, and they work on the farm and they raise everything. And they raise everything in large batches. So a lot of the food that's provided both in detox, partial hospital program, is all organically grown and comes from the farm. And then again, the client is also learning to care for things, care for items such as raising crops. Again, although food is holistic, it's organic. We do horticulture, which utilizes various planting, harvesting, and floral arrangement activities. While persons engage in an active role in the agriculture, they also process the layers of metaphor around the experience. Some examples of metaphor would be the cycle of crops, paralleling that to the life cycle. Clients will gain practical skills to aid in their recovery, as well as problem solving, task initiation, socialization, and they, of course, gain a lot of experience in planting and growing. Meditation, we have a sound chair. Many times when a person's experiencing a lot of anxiety, or they're just having a bad day, or they're feeling ill, I'll recommend that they spend some time in the sound chair. And on the sound chair, they're connected to a headset and they can listen to sounds of the ocean or raindrops, whatever is going to help them relax, as well as soothing music. We have music therapy once weekly. This again is facilitated by a licensed music therapist. People will use music as a form of expression and healing. The types of groups during music therapy will vary. Sometimes it's using instruments to create sounds together as a group. Sometimes it's learning for them how to play an instrument. And other times it may be processing the meaning behind songs they connect to. And there are even songwriting workshops offered. We have personal training right behind the medical unit. The medical unit in the partial hospital program is housed in a separate one-story building. And really the two parts to that building, one is a medical office, one is a medical exam room, and the back end of the office, which is a separate wall, it's another room, but that is our training room where we have ellipticals and weights. We have bikes to ride. There's all types of physical exercise equipment. Now, clients can go to the gym whenever they want to work out. However, we also have a personal trainer who's certified, and that person comes on twice weekly who will actually do individual personal fitness and training goals with the clients, whoever wants that. There's support individuals to help the client achieve goals around personal wellness. And then the sessions get tailored to a person's unique wellness goal. Could be weight loss, it could be building body strength, and even in some of our clients, improving mobility. Poetry gets offered once per week. This is another creative therapy where persons are guided in an alternative form of self-expression and processing. They engage in both writing their own personal poems, as well as dissecting and processing other famous works and how they may identify with such work. And then, of course, a lot of clients then can tie this to recovery or also to their substance use problem. Reiki is offered twice per week. This is a specific form of energy healing. The certified Reiki provider utilizes their own hands, either hovering over the person with gentle touch or even from a distance across the room to help unblock the chakras of the person. It helps create a relaxed state and facilitates stress reduction. The ropes course. This is a challenge. This is something I could not do because I'm one who really has a tremendous fear of heights. So this is really a suspended skyway course between the trees of South Jersey. When you live where I live in South Jersey and where the PHP program is, you technically are in the Pine Barrens of New Jersey. And so it's a suspended course. People wear a harness so that if they fall, nothing hopefully will happen to them. And they walk across a suspended skyway from one side to the other side. And what's interesting, when I talk about some of the patient's stories, you'll hear how the ropes course has really helped them to participate and to get over their dependency. Now, one of the things that we have to do as a medical team, and really we are staffed, and I'm very proud to say this, on the detox unit and in the partial hospital program, the medical team are all advanced practice nurses. We have a psychiatrist who is a medical director, but he does not see the patients in detox. He does not see the medical patients on the partial hospital program, but any patient admitted to the partial hospital program gets a minimum of a 1 hour session with the psychiatrist. So every patient is evaluated psychiatrically, and that's his primarily role, as well as serving as the medical director. So I'm proud because we're really staffed with really per diem MPs. I work on Fridays and I work detox every other weekend. Audrey works 2 days a week. Robin works 2 days a week. They have other jobs, but it's a good team, and we're all steeped in addiction. So the care that's provided medically is really done by APNs, we're very proud of that. There's sound healing. This is offered twice per week. This practice utilizes a series of bowls, either from crystal or specific metals. They're toned to notes and played in a series that creates frequencies meant to unblock and rejuvenate energy flow within the body. It creates deep feelings of relaxation and helps to lull persons into a meditative state. And I have both of these, interventions on one slide, primarily because, right, they fall alphabetically, but looking at it as well, when you talk to clients, these are two of the most important programs that we offer that patients seem to benefit greatly from. Then we have yoga. A lot of the patients love the yoga too. They receive yoga several mornings per week as one of three options for their morning practice. They also receive several different types of yoga groups during an afternoon during the week. Some of the types of yoga offered include power yoga, which is more intense and switching postures with goals around strength, balance, and breath work. There's restorative gentle yoga, and there's trauma-informed yoga. And, our counselors then tie a lot of the groups that they do to some of the activities. For example, we always run a trauma-informed group session with counselors as well. So let me share now what some of the clients think about these services. And I'm going to share 3 client stories. And one's a very personal story of mine, which is the third client, and you'll hear about that in a few minutes. So the first client that I want to discuss is a young woman. Her addiction had started with alcohol, and then she went to treatment for alcohol dependency, and she was able to maintain sobriety from that substance. Then stressors started in her life again, and she stated that she started to abuse heroin. The client rapidly progressed to injecting up to 7 bundles of heroin daily. She stated that, quote, "My addiction was controlling my life and I could not control myself," end quote. She went to a treatment center for detox and decided to go on medication-assisted treatment. And I know a lot of people are now calling it medication for opioid use disorder, so whatever you want to call it, with Suboxone twice daily. And she was on the medicated assisted treatment plan for 2 years. Following MAT treatment, she stated that she really wanted to be totally drug-free. So she decided to go to treatment, and then she sought a treatment center specifically that provided holistic services. So the first step of the program was the acute medical detox unit. There she received medically monitored care. She was placed on a Suboxone detox taper. And our tapers and our program, we really treat the patient holistically from the start in the detox unit. So our psychiatrist, who's our medical director, but also myself and the other MPs, we are very tuned to, I'm a big believer in a lot of like holistic vitamins and that type of thing. And what we noticed, we do extensive lab work on every patient's that admitted to detox, including every type of STI, complete metabolic panels, vitamin D levels, the whole 9 yards. And what we noticed living in the Garden State, New Jersey, especially in the wintertime, because it gets dark so early, most people come in with a low vitamin D3 level. And we're very big on that because personally, I believe vitamin D3 prevents a lot of flu and COVID. I also believe that there's research now it can be heart healthy. It prevents Alzheimer's disease, they think. So we're big believers in vitamin D. So every patient, we have what we call an alcohol supplemental set, and that will be like your thiamine and your folic acid and all that. But the opioids, they will at a minimum get a multivite, and we use vitamin D3, 50,000 international units weekly. So she was placed on, that. And we also use what's called PRN medications like clonidine if needed for high blood pressure, anxiety, Vistarol, you know, non-controlled substance sleep meds, that type of thing. And so she described coming off Suboxone being really difficult. And I think until I actually started seeing some of the patients in the partial hospital program, I didn't realize how hard it is to get off Suboxone, especially if you've been on it a while. But it is tough because I've had clients tell me it was the worst 2 or 3 months in my life getting off of Suboxone. So it's something I think about. So the holistic treatment at the center then also starts with holistic meals. They are served in the detox unit as well. Other than perhaps brown sugar or some holistic sugar supplements, no sugar gets provided. She attended group meetings, 12-step meetings, educational. Also group meetings provided by nursing and counseling. She started to engage in holistic activities, primarily in detox, yoga, massage, and chiropractic. And then after being in the detox unit for around 8 days, she was off the Suboxone now. She then stepped down to the partial hospital program on the main campus in Egg Harbor City. And here's what she said when I asked her about the holistic treatments and what helped. And what she said, what really helped her was that she had this mountain to climb, and that the holistic treatment helped her to climb that mountain. She said the facility has a ropes course, which I know about it because the other thing that we have to do as a medical team, we have to approve every client that they're capable of doing the physical activities. So we're very familiar with the ropes course because specifically one of the approvals is for ropes. So again, here you're on that suspended walkway that's rather high. You wear a harness. If one is afraid of heights, it may not be for you. But a lot of clients who have that phobia also attempt that course because they want to get over their fear of heights as well as combating their substance use disorder. So the client benefited from this as, according to her, the ropes program gave me the confidence that I could combat this addiction as I was able to combat this rigorous course. The facility provides equine therapy. And again, clients are taught how to groom horses, how to feed the horses, how to care for them, as well as going on horseback rides, and they do. And the client compared equine therapy with the ropes course. Again, I had to mount this big course. This is a direct quote from this client. This to me was like climbing the big mountain before me, that mountain being my addiction. It was another therapy that helped me scale that mountain. The client thoroughly enjoyed the holistic food, and on the in the houses they have GABA, which is great for anxiety and for sleep. It's a natural supplement. She stated that she had engaged in all the holistic activities. Horticulture taught her about natural elements. Reiki and yoga helped with her physical body, and the flotation bed relieved anxiety and contributed to her overall health. Acupuncture helped her chronic pain. She also felt that the ultrasound therapy provided by the chiropractic was excellent. Client two started by telling me that was a bad alcoholic. I'm in my early 30s. I had to go to the hospital to be admitted. My liver enzymes were elevated and my eyes were yellow. I then went to a detox center, from there to a partial hospital program, which embraced holistic therapies. And of course, she's talking about our PHP program. I knew that if I did not stop drinking, that I would surely die at a young age. And, haven't we seen, I don't know about you in your practice, but I've seen such a dramatic increase in alcohol abuse since the pandemic occurred. And when you talk to clients, I mean, they will tell you that doing virtual meetings through the pandemic just isn't the same. I was locked up in a room. I couldn't go to work because you couldn't work. And so I just turned back to alcohol. And, we have been seeing so many clients who have relapsed on alcohol. The holistic treatment benefited me immensely. Now, this client felt she benefited most from the sound healing. Glass bottles were utilized to create a soothing sound. I was able to focus on deep breathing. It allowed me to center myself and relieve stress and anxiety. Art was beneficial. I could express myself through art or writing. And I kind of love this story that she shared with me. We painted a pumpkin. I painted my pumpkin green and red. Green stood for go, and red represented stop. And what this brought to my mind, I often talk when I teach on substance use disorders that, and I learned this from a psychologist at the University of Pennsylvania, that you have a stop and go mechanism in your brain. Something tells you to do something, so you go, and then something tells you to stop. And I always use that as an example with myself. Like if I go out to dinner, I'll have a 5-ounce glass of wine, but I stop because I don't want to get a DUI. And what the psychologists relayed to us, that in a person with substance use disorders, and because of the neurobiology, that a lot of times they don't have that stop mechanism. They can't stop, so they continue to use. So she decided to paint her pumpkin green and red, green standing for go, red representing the stop. So the green side permitted me to drink alcohol, where the red side signaled me to stop drinking. I then painted a circle around the pumpkin. This circle was more in the form of a labyrinth. I needed to let go of my addiction, so I smashed the pumpkin. What happened was that there was one small piece of the pumpkin left, the piece with the word go on it. I had to get rid of it. I did not even want it to rot the soil, so I demolished this piece of the pumpkin. I could then let go of my alcohol addiction. And this probably is one of my best stories, but kind of like very personal to me. And I will share it because I think we learn from sharing. I'm going to give you a little backdrop before I read some of this, but the story is about my 23-year-old niece. My sister and I are very close. We're the only 2 children in my family, from my parents. And so we're close. And of course, my niece and nephew are very close to us. And I had noticed that Abby, who was always very thin and all, looked to me like she was putting on weight, but a lot of it was in her face. And my sister is like an excellent cook. That's all I can say. And she has us over for dinner a lot. And we were over there. This goes back a year ago, I think May. And we were over at her house for dinner. And my niece always has a water bottle, which we later found out what was not water was vodka. And so we were sitting at the dinner table, and my niece was on the opposite side of my wife and I. And my wife, who really doesn't say much, and and I'm looking at my niece and I'm thinking, darn, her eyes look a little yellow to me. But I'm thinking I don't want to upset my sister, especially at a family dinner, and maybe it's just the way the light is. And then, of course, I'm not even thinking alcohol. I'm thinking, oh gosh, I hope she doesn't have like a liver tumor or something, because Abby was like the perfect child. She was quiet. She was like number 3 in her class. She worked. I mean, she went to beauty school, the whole 9 yards. And I just never dawned on me that she would have a problem, right? And so my wife opens her mouth and she says, Abby, your eyes look yellow to me. And I kind of kicked my wife. I said, no, they don't. And then Abby got up and came closer to my sister. And I said, yeah, it's the light, because then they didn't look as yellow to me. But I kind of kept that back in my head, and then it was a week later. We were there on a Saturday evening. It was a week later on Sunday, 7 o'clock in the morning. My sister calls me. Abby's had a problem with alcohol. I've known about it for the past year. She's been trying to get off it. She hasn't drank in 3 days. And I think she's in acute withdrawal. She can't even stand on her feet. Can you help us? So I told her, I made a call and then I told her who to call. And we got her into our detox unit. This was on a Sunday morning. Um, you know, my sister thought she was alcohol free. She stated she had discussions with her that she was really trying to keep an eye on her. But here she had been drinking and had this 3 day period of not drinking, which threw her into acute withdrawal. So then the relative stated that she tried to stop drinking alcohol 3 days ago. She was sick and probably in acute withdrawal. Um, she was able to get her into the treatment center, but God bless my nephew, she could not walk, and he actually had to carry her into our center and had to put her into a wheelchair. So again, she was admitted. All intent and purposes, she could have easily been admitted to an acute care hospital with the shape she was in, but she didn't want to be hospitalized, so we decided to give it a try. On admission, she was in acute alcohol withdrawal. Her lab values demonstrated a marked elevation in liver enzymes, and her bilirubin was significantly elevated. It was close to 9. She was like 8.9 or something like that. The sclera of her eyes were jaundiced. Again, I think she really met criteria for inpatient admission, but her preference was to remain in treatment and give it a try. Following admission, she was put on a Librium detox taper with a standard alcohol supplemental vitamins of thiamine, folic acid, a multivite, and vitamin D3. Now, what was interesting, where my sister thought she had a problem for, a week, a year, when she cleaned her room when she was in treatment, she found empty wine bottles and different bottles, probably about 40 bottles in her room. And her belief was she had gotten a job at a winery in the gift shop, and she believes that she actually started drinking around age 18. And I would concur with that because of her physical condition. She was in detox for 2 weeks, and then she went to our partial hospital program, and she truly engaged with that program. So this is what she stated that she found most helpful. Again, sound healing, healing bowls, different vibrations and sounds help create balance in your brain. This helped me to be calm. She stated that it was extremely relaxing. She also participated in Reiki and yoga. She particularly enjoyed the family constellations program with the Diggerdew. And she states that she did have a lot of leg pain, and she did through detox, and probably up to about 4 months after treatment, she was still having leg pain from the alcohol use. She stated that acupuncture helped with her physical leg pain. She stated that meditation caused her to examine her life and all that she had done. She stated that it helped her focus on new and healthier goals. She stated that she had a lot of fear of the ropes program as she did not like heights. She stated that the program really helped her to get over her fear of heights, but also the other fears in her life. She further stated that this program provided her with the strength to combat everyday events. She loved the horses, said they were great. I cared for the horses and I rode them. And equine therapy with the horses, she said, provided a feeling of comfort. She compared this with therapy dogs. She stated, the same way people get help from therapy animals, that was the help that she elicited from the horses. Other activities that the client found to help me were horticulture, the farm, and individual group therapy. And this client decided to go on medication-assisted treatment with Vivitrol. She has been on Vivitrol for over a year now and has maintained total sobriety. Which brings me to talk a little bit about Vivitrol. I know Connie Mealy mentioned this in her program. I'm going to go into a little more detail because our program is a firm believer in Vivitrol. As you know, it's an antagonist, it's an naltrexone extended release. Over 50% of our clients are on Vivitrol. Every client who comes both into detox and the partial hospital program on admission are assessed to see if they would be interested in using Vivitrol as a relapse prevention strategy. As you know, Vivitrol is a once monthly injection. So now there are certain requirements for the administration of oral naltrexone and Vivitrol, the extended release. The contraindications are anyone who's on an opioid medication. If you have an allergy, certainly to any of the components of naltrexone or Vivitrol. Clients usually have to be off opiates for at least 7 to 10 days. This can even vary longer because so many clients are using fentanyl, and fentanyl stays in your system much longer. And that's because if you gave them naltrexone or Vivitrol, Vivitrol is going to last close to a month, you're going to put them into a precipitated withdrawal like they've never seen before. So every patient that starts oral naltrexone, and every time they get Vivitrol, they get a urine UDS to make sure it's negative for opioids. So even like in detox, if we've done labs that went out to the lab and they're just, say, an alcoholic and, all the labs come back negative for any type of drug, before we would give them naltrexone, we will still do a urine dipstick in the center to make sure they're negative for opiates. And then anyone receiving Vivitrol, because you're going to get an injection that's going to last for a month, we do an oral naltrexone challenge. And the challenge that I ordered 25 milligrams of naltrexone once daily for 2 days, then bump it up to 50 milligrams daily for another 2 to 3 days. And then if they have no side effects or reactions, and as long as they have the negative UDS, which we would have done before the naltrexone, we'll do it again before we give the Vivitrol injection, they would get their Vivitrol. To give Vivitrol, the client has to have had a history and physical exam, as well as the urine drug screen. The UDS has to be negative for opiates. Vital signs have to be taken and documented. And I take all vital signs: blood pressure, pulse, heart rate, temperature, and pulse ox reading. The Vivitrol must be refrigerated. Prior to being administered, it's really recommended that you take it out and let it warm up for about an hour or two. If you don't, the Vivitrol can clot in the syringe, and when you're injecting the person, it'll just clot, and you won't be able to, insert the Vivitrol. So then you have to pull the needle out and get a whole nother set and start all over again. And most patients, myself included, would not like that. It's administered deep IM in the gluteus maximus muscle, the upper outer quadrant. Injection sites should be rotated each month because, again, you don't want to create sterile abscesses. I always say, and clients laugh at me, I say, we're going to give your first injection on the right side. And for 2 reasons. This is what I want to plant in your head. It's the right thing to do. And then this way you'll know that the first injection I got was right. The next one will be left. Then we'll go back to right. So you could count how many injections you had and figure out which side of your butt the Vivitrol is going to go on. What's interesting with Vivitrol, where you think you would Z-track it because of the viscosity of the drug, you don't. It's contraindicated. You just use your 2 fingers to spread the tissue. And it's always recommended that Vivitrol be administered 2 to 3 days earlier than the last injection. So, for example, if Vivitrol is given on November 30th, then the next Vivitrol injection would be administered around December 27th, my birthday. And that's what I always do. And I always give clients their date when they're due to come back for Vivitrol. So we have, a lot of clients on Vivitrol, many people in sobriety over a year. We use it both for the opioids and the, alcohol. That's what it's indicated for. If they don't want Vivitrol, then we will try to get them to take oral naltrexone. But I'm really a very big believer in the Vivitrol because I've just seen phenomenal results with it. And when you combine our census on the partial hospital program, we have anywhere from 40 to 50 patients. And the IOP program in Ventnor, we have another 40 to 50 patients. So in that total group of close to 100 patients, we have at least 50% or more of the clients on Vivitrol. So we've had a lot of success with it. With that, I will entertain questions. If you post them in the chat box, Suzanne will read them to me and I will try to answer them. And I will put up my contact information at the end.
Oh, okay. Couple questions about insurance. Can you hear me?
Yes. Mm-hmm.
So I have some questions about how is the diversity within your population of patients, and does insurance cover this?
Okay, that's a great question. So what I found out, I shouldn't say this, but my other book that I write is on finance, and that was just published, and I included addiction services in that book. So what I found out, the company that I work for here as a practitioner, they are not networked with any insurance company. And we get many clients. And so it's clients who are looking for holistic services. And the vast majority of the insurances will cover it. And they basically work out an agreeable rate with each insurance company. And that will vary by insurance company. So yeah, the services are covered. Now, what's included in the price is the all the therapeutic modalities that I talked about. The only thing that clients pay for is the living expense in the house, going to the Serenity House. And I think that is $1,500 a month, to cover the food and the expenses, and all the clients there cook and all, but the food and all is provided. Again, some clients who live locally may come from home and live at home and not go in the house. However, I can tell you, I will see more clients relapse that way than when they live in the house in a community. And the houses are separated. There's a men's house, there's a women's house, etc.
Is it private or public insurance policies that are accepted?
It is, yes, it is private insurance policies. Yes, we don't, to my knowledge, I'm not sure if we take Medicaid. I don't think we take Medicaid. And of course, Medicare doesn't cover addiction services. So Medicare is out of the question.
And how is the diversity within your population of patients?
There, we have diverse patients. Give me an example. We have an African American population. We have, Asian population. You don't see a lot of Asians access treatment, but we've had some of the Asian population. Right now, I have, and we've had a few clients like that from India. Right now, we have a patient right now who we're treating was in detox, now in the partial hospital program from India, and resides part-time down at the shore here and then also in India. Doesn't speak fluent English, but we are caring for him. So yeah, we have a diverse array of clients that access treatment.
And here's another question. I am accustomed to the naltrexone challenge on inpatient units. In an outpatient setting, how do you mitigate for fentanyl since it's not a weight test and not indicated on a urine dipstick?
Well, how we account for fentanyl, we do biweekly drug screens that go out to the lab. So that will pick up any fentanyl that the clients used. And so we'll have a lab specimen in the system that I can look at, to see if they're negative for fentanyl. And actually, the dipsticks that we are using, the UDS, does pick up fentanyl as well.
And are there any adverse effects on such a high dose of vitamin D3?
No, because their vitamin D levels are so low. So normally what we would do, like, for example, very honestly, I take 5,000 international units a day. So 7 times 5,000. And usually during the winter months and fall, when we get into flu season, I double it and take 10,000 a day. So I'm taking 70,000 units every day. And my vitamin D level is high, but it's not out of the normal range. Most of our clients, I get some vitamin D levels where they have 8 25 or higher is normal, but really you want to be more like around 50 or so. So again, and they're going to be on the vitamin D 50,000 international units weekly. Think how long they're in detox. Oftentimes they're just getting one dose because the average length of stay in our facility is around 6 to 7 days. When they go to partial hospital care, we'll order 2,000 international units once daily.
Al, you mentioned the cost. I want to go back to that question. If someone was self-paying, what would the cost be?
That would be worked out individually with someone who's self-paying. And I don't really have privy to that because I don't get involved with that. But I know they work out specific, you know, criteria with every individual based on, you know, what their need was and what they could afford. And then the other thing that they do, and I'll be very honest, and we have a lot of this, they do scholarships for a lot of patients. So they'll do scholarships where basically they fund the treatment. We always have 2 to 3 scholarship patients at a time there. And that's because they have a foundation and they raise money specifically for the scholarships.
There are no other questions.
No, are you sure? Okay. They're great questions, by the way. Well, I guess I'll end with saying I never thought I would be, I believe in a lot of holistic interventions, you know, but I never thought I would be working in a center like this. And they were looking for some per diem NPs about, you know, 3 years ago. I'll be there 3 years in October. And one of the MPs who worked at Shore, where I was CNO there years ago, and is good friends with the owner of the facility. And she mentioned my name. And then it so happened that our executive director in detox used to work on the adolescent unit where I used to practice at when I was working there as an MP. And one thing led to another, and I came on board, and that's how I got to this facility. But what I really love about it, because the prior facility I was in was so big and has even gotten bigger, I really like this 26-bed unit where we have 20 detox and 6 residential. It's staffed very well. We have a high RN ratio. There's always at least 2 nurses on, and there's techs, you know, there's behavioral techs and medical assistants. And so it's well staffed and they're very competent. And, you know, I feel it's very safe. And the director of nursing is awesome. She's very committed to substance use disorders, and she works very well with the clients and the staff. So it really is a pleasure to practice there. Like I said, I'm there every other weekend, and Drexel allows us 1 practice day. So I usually practice on Fridays is my big day because that seems to be a slower day at Drexel, but I absolutely love what I do there. And it's great to see the partial hospital program because I've always done detox. And when I can get over to the partial hospital, it's really great to see people in recovery. And it's really great. It's a 30-day program. Some people do 2 weeks, some do 30 days, some do a little longer. But it's great to see them like the first week when they're still having some post-withdrawal symptoms and all, and then to see them like in the 3rd or 4th week when they're like a brand new person and how much they've gained from all the therapies. That's what's so great about it. So thank you for being part of it. And hopefully if you're not a member of ASAN, you will join us.
Thank you, Al.
All right. So did I get everybody done on time?
Yes, you have 5 minutes
Oh,
left.
5 minutes to spare. You gain 5 minutes back in your day. All right. Well, have a great week and a great rest of the summer. And really look forward to our next 2 presenters, because with the common psychiatric disorders that we see, I think that's going to be excellent. But then also anything you wanted to know about lab values, Dr. Ferguson's excellent. So on August 24th, you do not want to miss that webinar.